Hi everyone, welcome back to the channel. The Pitt is a high-octane, high-adrenaline rush medical procedural drama, a Max original currently still running until today. Right now, we're on Season 2. This show offers a real-time depiction of a single 15-hour shift at Pittsburgh Trauma Medical Center, otherwise known as The Pitt. Each episode covers 1 hour of the shift, immersing viewers in the often non-stop pressures at a hospital. It follows the life of Dr. Michael Robinavitch, an attending physician dealing with the effects and impact of the COVID-19 pandemic. Set entirely in the hospital, it tackles the professional struggles, ethical conflicts, and constant decision-making processes that medical workers face under pressure. Here's your recap from the very first episode until the latest episode of the currently ongoing Season 2. However, before we continue, please ensure you're subscribed and hit the notification icon so you don't miss any of our content. And if you enjoy this type of content, don't forget to like. This really helps the channel. Now it's time to get into it. Let's dive right in. Attending physician Dr. Robinavitch begins his shift at the Pittsburgh Trauma Medical Center, relieving overnight attending Dr. Jack Abbott and welcoming residents Dr. Mel King, Dr. Trinity Santos, and medical students Victoria Javadi, who is a surgeon's daughter, and Dennis Whitaker. Dana Evans, the charge nurse, finds out that Heather Collins, a senior resident, is pregnant. The team also provides treatment to Minu, a non-English speaking patient with a degloved foot after getting pushed onto the subway tracks together with her rescuer. Medical student Victoria faints upon seeing the foot. Then her mom, Dr. Eileen Shamsai, embarrasses her by visiting. Gloria Underwood, the hospital manager, warns Dr. Robby that the Pitt should improve its satisfaction ratings among its patients. Resident doctor, Dr. Cassie McKay, meanwhile, provides treatment to a triathlete who suffered from shortness of breath, worsening into a cardiac arrest. Mel and senior resident Dr. Frank Langdon evaluates Tyler Jones, a lethargic kid, discovering that he accidentally ingested one of his dad's cannabis gummies. Meanwhile, Whitaker accidentally injures his finger in a patient transfer. Collins ascertains that Minu can speak Nepali. Robby and McKay meet with Teresa, who made herself ill to get help for her son David to protect his life. David flees before Robby and Kiara, a social worker, to hide his intentions, including harming girls. A flashback of Robby working during the pandemic. The kids of elderly guy Mr. Spencer, who is suffering not just from Alzheimer's disease but also from pneumonia and sepsis, decide to override his advance directives and DNR order and pursue treatment that can cause him more pain. Langdon reprimands and scolds Santos for providing treatment to a patient without the go signal and nod from the superiors. Meanwhile, Mel does a cricothyrotomy successfully on a patient suffering from a Lefort 3 fracture. Also, Javadi finds out McKay wears an ankle monitor while providing assistance in triage. A homeless man arrives with a coat full of rats that escape in the ER, to Gloria's despair. Mel, Langdon, and Kiara try to handle Tyler's angry mother and ensure the intervention of child services. Teresa attempts to contact David. Resident Samira Mohan finds out that Joyce, a patient suffering from crippling, debilitating pain, isn't looking for drugs, but is diagnosed with sickle cell disease. A resident in the surgical department, Yolanda Garcia, places full trust in Santos to assist her in a fasciotomy. Meanwhile, Javadi clashes and argues with Santos. Collins wishes to go to the ethics committee and overrule the children of Mr. Spencer, but Robby says he must buy time. He struggles to inform the mom and dad of Nick Bradley, a teenager, that Nick is already brain dead. The cause? Fentanyl overdose. He prescribes tests, albeit unnecessary, to help them process his demise. Javadi asks about McKay's life. Denise struggles to process the death of Bennett Milton. Out of the connection they've both established with each other, Javadi then finds himself with McKay, successfully treating patient Jenna, who suffered an overdose after taking Xanax with fentanyl. Santos frustrates her colleagues with her brash and overconfident personality. Collins puts trust upon Javadi to intubate a patient that has been shot in the chest using a nail gun. A patient with a STEMI gets treated by Mel and Langdon. They also conduct a cardioversion to treat the addiction of a vapor. Robby gets angry to Mohan over focusing too much on individual patients, affecting the clinic's productivity. He tells her to practice more self-confidence and overcome her fear of committing a mistake. Nick's dad recognizes his friend Jenna, but angrily accuses her of having handed the fentanyl to Nick before being handled by the security. Kiara and McKay speak with Robby, telling him to get David back to the emergency room at all costs. Abbott pens a letter that Robby reads. The letter is addressed to the sister of a dead veteran he provided treatment during a night shift. Mohan convinces Whitaker to follow him and face his fears. Someone, still unknown, steals a hospital ambulance. Mr. Spencer's kids agree to withdraw treatment to de-burden him of the suffering and pave the way for less traumatic demise. Clinic staff members speculate on the stolen ambulance. Robby extubates Mr. Spencer and pats his children, telling them to perform Ho'oponopono, a Hawaiian ritual that his mentor, Dr. Adamson, introduced him into. A flashback of Dr. Adamson's death in the Pitt during the height of the pandemic. Mohan reprimands Santos for her poor bedside manner with Jenna. Langdon also berates Santos when a patient almost dies Collins after she ordered to use BPAP without first consulting a superior. Doug Driscoll, an impatient patient, becomes racially abusive to nurse Mateo Diaz. Meanwhile, Javadi sutures a patient's wound and corrects an error on gender on her medical record. Mohan and Mel treat a baby suffering from a hair tourniquet, as well as diagnose a young woman with an imperforate hymen, then offering support to her dad. A psychotic patient, Mr. Krakozia, gets an injection care of Whitaker, Dana, and the other nurses on the bed in the psychiatric department. Jenna says sorry to Nick's parents, explaining that they take the Xanax despite not prescribed, so sleep can set in, treating their overdose of coffee during a study session. Collins prepares to administer a medication abortion prescribed by Abbott to Christy, a teenager. Santos finds himself in an argument with Langdon over the treatment plan for patient Joseph Marino. She also tries to report a failing lorazepam. Robbie and Mohan instruct and teach Whitaker via his next patients. Jake, the son of Robbie's ex-girlfriend, whom he has established a family-like bond already, visits the clinic to fetch 2 tickets for an event from Robbie. Collins's ultrasound results suggest that Christy may be past the gestational limit for abortion, implying that Abbott may have falsified his data. So Robbie does another ultrasound, recording the gestational age as a day within the cutoff. McKay connects with a struggling mother named Sherry by sharing her own life story too. Mel comforts Rita, the daughter of an old patient named Ginger Kitajima, who's struggling with caregiver-related stress. She gets an advice to take a break. Rita collects her car, but doesn't return anymore. Robbie goes angry with Mohan over her slowness on the job. Javadi becomes insensitive to Sherry, embarrassing her, which causes her to move away. McKay scolds and confronts Javadi for her judgmental and nosy attitude. Langdon performs an impressive retrograde intubation under Robbie's guidance, who later tells him that he has recommended him for a prestigious fellowship. Collins praises Mohan for her approach to patient care. Collins is about to administer the abortion medication when Christy's mom arrives and tells them to stop. Collins finds out that Christy's supposed mom, who initially accompanied her, is actually her aunt. Gloria sends a warning to Robbie that she'd entrust the clinic to a corporate management firm if patient satisfaction scores don't increase. Santos accidentally drops a scalpel that hurts and stabs Garcia's foot while treating a patient. Langdon, Collins, and Javadi send over treatment to 2 frat men who are probably responsible for the theft of the ambulance. Robbie commends Mohan for her attentiveness, but reminds the team to keep improving the patient satisfaction ratings. Javadi's mother's overbearing behavior embarrasses her. Kiara and Dana comfort Mel and encourage her to talk with Ginger about her daughter's disappearance. Nick's child being brain dead has been confirmed by Robbie to the parents. They then get introduced to family support headed by Emma to handle the shock, but his mom storms out when asked about her son's consent for organ donation. Collins gets excited about her pregnancy after witnessing a patient's close relationship with his mom. Langdon and Santos reveal to Joseph he has neurocysticercosis. McKay suggests that David be reported to the authorities, but Robbie says no. Mel calls her sister Becca, suffering from autism. Christy locks herself inside the bathroom and refuses to leave without getting abortion medications. Christy's mom and aunt fight, shoving Collins when she attempts to meddle. Robbie, with Gloria, rants about overcrowding and understaffing. Mel's experience with her sister helps her vividly connect with a patient suffering from autism about an ankle sprain, something that Langdon struggles to communicate across. Santos asks about Langdon's weird behavior and demeanor. Collins convinces Christy's mom to allow her to get the abortion. The wife of Silas confesses to Santos that she drugged him with progesterone to dull his libido out of her inkling he's molesting their daughter. Langdon, Robbie, and Whitaker call in the ECMO team to assist in treating a patient diagnosed with STEMI. Javadi and Mohan provide treatment to Nandi, a digital influencer with suspected schizophrenia, but her symptoms are still being investigated. Mainu's rescuer states he'll give a statement to the authorities. Santos tries to get Silas's daughter to recognize the abuse, but is unsuccessful in doing so. Robbie scolds Mohan for conducting unnecessary evaluations, but Collins encourages her. Mohan finds out that Nandi used a contaminated face cream, leading to mercury poisoning. A flashback of Robbie on Adamson being supported by ECMO. Robbie and Collins fight over his treatment of Mohan and the staff. Robbie and Kiara inform Silas's wife they must turn her into the police for drugging her husband, to Santos's despair. Langdon commends Mel's skills. Meanwhile, Santos threatens Silas despite being incapacitated. Collins suffers from a miscarriage inside the bathroom. Immediately, Collins reports back to work. Santos looks into and investigates how Langdon handles lorazepam and Librium that he prescribed to the regular patient Lewis Cloverfield. Rita gets back to the emergency room after falling asleep in a car. Meanwhile, a patient with a severed finger starts flirting with Collins. Collins. Elsewhere, Langdon treats Willie Alexander, a patient suffering from Twiddler's syndrome, and an ex-paramedic with the Freedom House ambulance service. Mel and Kiara offer help to Rita and Ginger for accessing the home care services. However, the team fails to save Amber, a 6-year-old drowning victim. Javadi impresses her mom by determining and finding out that one of the symptoms of her patients was due to a spider bite instead of her Crohn's disease. The mom and dad of Nick say yes to organ donation. Meanwhile, Santos airs her concerns about Langdon regarding Garcia, who dismisses them. McKay believes that Piper, a young woman suffering from chlamydia, may be a victim of sex trafficking by her overly controlling and micromanaging boss. Mohan sends support to Nandi concerning her recovery. Elsewhere, Dana and McKay get Piper alone with the excuse to try to get her to confess. Mel struggling to prepare Bella, the sister of Amber, to hear the news. Meanwhile, Dr. Robby tells Willie of the demise of Adamson after revealing they actually had worked together before. The staff and the friends of Nick, with the family, conduct an honor walk as he and his mom and dad exit the hospital. Collins confides in Dana. Meanwhile, Dr. Robby wants to know from Dana about Collins' health, trying to console the team following the demise of Amber. 2 women get admitted after starting a fight in the waiting room. Dana and McKay fail to urge Piper to confess before she leaves. Mohan and Santos send treatment for a patient in seizures from MDMA overdose, which angered and enraged Langdon, prompting him to launch into an aggressive and commit a verbal attack over to Santos. However, Robby lectures and reprimands Langdon on how he behaved. Homeless patient Krakosia says sorry to Whitaker after urinating on him during one of his psychotic episodes. Langdon sends assurance to Mel. Javadi turns infatuated with Mateo. Doug complains to Dana concerning the very long wait time, threatens the staff, and leaves without permission. The clinic admits 2 victims of a car crash, including patient Paula, who had been spotted earlier by McKay. Meanwhile, McKay, Collins, and Robby find out that Paula had blacked out while driving because of sepsis that's caused by endometritis. Meanwhile, Whitaker decides on joining the clinic's street team to personally administer the medication of Mr. Krakosia. Collins offers a suggestion that McKay may have missed out on the sepsis in Paula's exam earlier due to fat phobia. Elsewhere, Whitaker catches a rat and Doug punches Dana in the ambulance bay. Law enforcement officers break in to speak with patient Teresa. Elsewhere, Dr. Robby provides treatment for Dana. Whitaker reassures the wife of a victim of a full-body burn in critical condition that everything will be okay, but Langdon thinks otherwise. Harrison, McKay's son, arrives at the ER together with his father, her former partner Chad, who has suffered from an injury due to a skateboarding accident. Dr. Robby chastises McKay for telling the police after the possible intentions of David, but she remains convinced that she only did the proper thing. Gloria attempts to reassure the nursing team following Dana's assault, but fails. Tensions keep going between Langdon and Santos, while Dr. Robby struggles to mediate. Javadi turns angry and aggressive towards the dad of a teenager, hit in the eye by a baseball, feeling he is pressuring his son on his baseball career, forgetting about his health. Mel and Mohan talk through about what it takes to be a physician while treating a victim of stroke with TNK. After Santos informs Robby her concerns on Langdon, Robby investigates his locker to find several stolen doses. Livid, Robby urges Langdon to go home first. Dana insists on continuing to work despite the injury. Robby then asks her to do a pharmacy audit on Langdon. David shares worrying messages over on Instagram. Mel and Collins help a surrogate mom regarding delivery and treat her from the complications. Following a clash, Mohan and Whitaker treat a man looking for morphine by giving him buprenorphine without his knowledge and consent. Meanwhile, McKay and Javada provide treatment to an ex-drug addict suffering from hepatitis B with esophageal bleeding. They use a Sengstaken Blakemore tube. Santos tells Garcia and Robby her concerns about the impact of reporting Langdon, but Robby sends her reassurance. Repeatedly, Robby says no to answering phone calls from Langdon. Jake and Leah, his girlfriend, call Robby from Pitfest to send their gratitudes for the tickets. Collins confides and opens up to Robby, talking about her miscarriage and the abortion she has been keeping secret. He informs her to go home first so she can rest. McKay starts a confrontation with Chloe over her son's custody. Robby support the petition of Teresa so that David can be placed under psychiatric care. Dana tells Robby she intends to quit. Meanwhile, the team receives information about an active shooter at Pitfest. Dana and Robby call Jake countless times, over and over again, but to no avail. Abbott, another emergency department attending physician, begins his shift earlier along with senior resident Dr. Parker Ellis, attending Dr. John Shen and surgeon Dr. Emery Walsh. Meanwhile, Shamsi, Garcia, and doctor from other department go assisting the ER. Although the hospital activates its mass casualty cases, SOP, to deal with the influx of the patients from the shooting at the event. Abbott, Shen, Walsh, and Dana take their responsibility as primary supervisors for emergency, triage, surgery, and nursing staff, respectively. Meanwhile, all people in the waiting room are dismissed. Mohan, Abbott, and Robby are delegated to critical patients. Javadi and McKay are assigned to patients who may die within 1 hour if not treated. On the other hand, Mel, Whitaker, and Santos are assigned to patients with wounds on the extremities. Mel discovers discovers a liver laceration in patient Sylvia, diagnosed with a broken leg. Langdon comes back to offer help. Meanwhile, Chad and Harrison wait in the lounge. There's Santos catching a journalist who faked an injury to enter the emergency room and snoop around to find information. The team starts to run out of supplies. Mel donates her blood to Sylvia, motivating other doctors to do the same. Javati surprises her mom by improvising a substitute test tube. Law enforcement officials inform the team the shooter might be headed their way. The phone of David is traced to where the shooting occurred. After an hour, patients continue to arrive at the ordinary pace. A helicopter brings in whole blood supplies. Meanwhile, the staff continues to use revolutionary procedures and equipment to treat patients, meaning those that are unconventional. Intraosseous infusion drills see many uses. Whitaker uses one to administer medication to a conscious patient, albeit with mistakes. Mohan uses one to relieve a patient's high intracranial pressure, and McKay uses it to disable her ankle monitor's distracting alarm sound. Kiara and Lupe, the ward check, capture photos of the dead to identify them and have a way to notify their relatives and kins. A patient tries to reach for his gun, causing panic in the staff before falling unconscious. Mel and Whitaker struggle to look for equipment to treat a patient. Lupe and Kiara tell Whitney Rivera about the demise of her husband. She then asks about her brother, who appears to be missing. Jake arrives with Leah in critical condition. Dr. Robby utilizes several liters of blood to treat Leah despite the grave disagreement from Abbott, but he fails to save her. Santos does an unsupervised REBO to stop a patient's bleeding. Abbott reprimands and scolds her for her rashness, but eventually praising her for the success of the procedure she administered. Law enforcers arrest David the moment he returned to the pit. Robby accompanies Jake to see Leah's body, with the latter questioning the former as to the reason he couldn't save her. Robby suffers from a panic attack, gravely overwhelmed by grief and guilt over Leah, Adamson, and the other patients who died. The team goes looking out for Robby. Whitaker finds him and reminds him of his duties and responsibilities. Dr. Robby returns to work, but is still short-tempered with his patients and co-workers. The hospital is transitioning back to its normal operations. The father of McKay arrives to bring Harrison home. Santos and Langdon struggle to work with each other for Max's treatment. Max is this patient suffering from an overdose. The brother of Rivera arrives at the emergency room, having developed an air embolism while helping the other victims in the festival incident. Ignoring the objections of Walsh, there's Mohan doing a risky procedure to save him, Abbott guiding him. The shooter is dead, according to reports. The team starts to treat Flynn, an unresponsive minor diagnosed with measles and possibly acute disseminated encephalomyelitis. Dr. Robby reports to the Public Health Service a possible outbreak. The police issues release for David, but he is still on a 72-hour psychiatric hold, leading to a clash with his mom, Dr. Robby, and Dr. McKay. Jake's mom arrives to see him. Mel becomes the catalyst to reunite a traumatized patient with her daughter, causing her to cry and break down in tears. Flynn's mom enrages Robby, who is refusing to allow a lumbar puncture after reading alarmist health information online. Abbott asks Dana about Robby's condition. The police arrest Dr. McKay for destroying her ankle monitor. Robby talks and negotiates with the police to release McKay, citing that she did heroic work for that day. Meanwhile, Santos concludes that Max tried committing suicide, opening up to him about a friend who killed herself too. McKay now is attempting to persuade David to go through counseling. Langdon begs Dr. Robby for another chance, a second chance, but their conversation only escalates into an argument. Also, a hospital employee is admitted into the pit with a crushed pelvis. Dr. Robby experiences difficulty focusing on the treatment. He guilt trips Flynn's dad into allowing the lumbar puncture without the knowledge of his wife by showing him the bodies of the victims from the Pitfest incident. Mohan's manic energy subsides, and she cries in the restroom. Dr. Robby delivers a speech thanking the day shift staff, but also dismissing them afterward. Dana takes down pictures from her desk, thinking of never returning to the pit. Mel fetches her sister at a care facility. Santos finds out Whitaker is now homeless, squatting in a room in the hospital, so she invites him to live in her apartment. Abbott finds Robby at the edge of the hospital roof, emotionally exhorting him to not feel like a big failure. The two then join several other doctors, physicians, and nurses for a beer in the park before Dr. Robby finally heads home. July 4th. Dr. Robby kicks off his final shift before his 3-month sabbatical leave he has been plotting all along in his calendar. Baran al-Hashimi is set to serve as the interim senior attending. Al-Hashimi is pro-AI-driven medical tools, testing them while supervising a procedure with Robby, Whitaker, and Mohan, assisted by new medical pupils James and Joy. Langdon gets back from the rehab but is kept at a distance by Rob, who assigns him to triage. He treats regular patient Louis Cloverfield and admits to stealing his Librium, but Louis shrugs it off. Meanwhile, Ethan Bostick, a 79-year-old patient with a POLST, is let to die in accordance with his wishes under the guidance of Whitaker. Mel reveals she's been named and dropped in a malpractice lawsuit. She now must appear in a deposition. Santos provides treatment to Kylie, a girl who accidentally fell down a flight of stairs, becoming concerned about possible abuse after noticing several bruises and red urine, signaling hematuria. Dana starts her shift mentoring newly hired nurse Emma as they respond to an abandoned baby and care for a homeless guy, Troy. McKay provides treatment to patient Michael Williams for a wrist injury, but his confusion and erratic behavior are suggesting his condition is more serious. Al-Hashimi later receives test results about the abandoned baby, leaving her speechless, without words. Now the abandoned baby undergoes more testing to confirm its sound well-being, but Al-Hashimi remains silent concerning what particularly left her shaken. Staff go collecting a urine sample and contact the police. Alan Billings arrives complaining a severe fall injury. Mel assists Robby in reducing his exposed bone. Mel confides in Robby about her malpractice case, which he reassures her is just routine. Mel's encounter with a flirtatious patient she's treating escapes upon seeing the police. Later on, she learns the man is a robbery suspect, a criminal. Langdon treats her injuries and admits to drug addiction, which she accepts without judgment or bias. Santos calls Kylie's dad, while Javadi does treatment to Grace, a nun, diagnosing a gram-negative bacterial infection. McKay is denied further tests on Alan when Robby and case manager Noel Hastings determine he lacks sufficient insurance and must be transferred. McKay saves another patient by removing broccoli obstructing his airways. Whitaker assigns James and Joy to Louis prior to informing Evelyn Bostick of her husband's death and later noting her memory gap. Al-Hashimi demos a new AI charting app, though Whitaker notices a medication error. Outside, Al-Hashimi and Robby debate the role of artificial intelligence in medicine until a college student arrives, suffering in psychosis. The college student is Jackson Davis, taken to the Pitt after an apparent psychotic breakdown. Meanwhile, campus security guard Tony Cinciolo arrives, complaining of a head injury after being struck by a chair that Jackson threw, and insists he'd like to stay as he wants to talk to the police. After toxicology tests and reports show there are no drugs in Jackson's system, the police determine Tony prematurely tased him. Dr. Robby and Dr. Al-Hashimi treat Mark Yee after suffering from a motorcycle accident. Tests stay hypokalemic periodic paralysis, and while Mark later regains consciousness, his wife Nancy collapses and exhibits internal bleeding. Kylie's dad, Benny, arrives and finds himself in a conflict with his girlfriend and staff over suspected abuse, but Dana reveals that the bruising that Kylie is experiencing is because of immune thrombocytopenic purpura, prompting Santos to administer steroid treatment and requiring Kylie to stay admitted in the hospital. Benny and his girlfriend go their separate ways after engaging in an argument. Robby treats Yana, a burn victim whose PT equals SD, from the Pittsburgh synagogue shooting is triggered by the fireworks. McKay realizes Michael Williams has a frontal lobe mass and contacts his ex-wife to discuss care. As the ER stabilizes, Dana learns the nearby Westbridge Hospital has issued a code black, diverting all ambulances to the Pitt. As the Pitt's ER gets ready for the diverted cases from Westbridge Hospital, Dr. Robby keeps Dr. Langdon in triage, assigning Dr. Whitaker, Dr. Santos, and Javadi to the first arrivals, all the while treating Vince Cole, a young man who suffers from an injury after falling through a skylight while attempting to do parkour tricks. During the treatment, Joy cuts her finger on embedded glass, and this requires HIV and hepatitis testing and assessment, but Emma accidentally drops and destroys the blood vial. James Ogilvy removes the big shard from Vince's back, causing really severe bleeding, though Robby, McKay, and Garcia manage to control this, saving Vine. Robby later on warns James to leave deeply embedded objects to surgeons. Whitaker saves his patient, Mr. Samba, from a heart attack by identifying a posterior STEMI and later treats Louis' toothache. Langdon provides treatment to Willow, who accidentally and oodly glued her eye shut. She finds herself asking for a certain Dr. J, who is revealed to be Javadi, now a TikTok star and sensation. McKay manually resets an elderly man's fractured tailbone and agrees to a date with another patient. Mohan provides counseling to the uninsured Diaz family on coverage options. Santos and Mel place a bulimic patient into treatment, while Santos finds herself being pressured by Dr. Al-Hashimi over charting. Al-Hashimi takes Langdon off of triage. Langdon suspects that returning cellulitis patient Debbie Cohen has MRSA or worse. Dr. Langdon and ER nurse Donnie move Debbie Cohen to Trauma 2 for further evaluating and testing. Robby is suggesting her condition could be related to SIRS. Additional testing reveals she's actually developing severe sepsis, which Langdon believes is absolutely treatable. However, Robby removes him from this case and privately tells Nurse Jessie to gear up for possible intubation as Debbie's oxygen levels are starting to fall. Gus Varney, an inmate from SCY Jones Forge, is brought in after being involved in an assault, but his guard refuses to remove his restraints, complicating Whitaker and Mel's efforts to provide treatment for his wounds. Santos is struggling to complete charting amidst constant interruptions, sharing duties with James, who evaluates a homeless woman later diagnosed with tuberculosis. Later, Santos determines James wasn't infected, but points out occupational risk. Dennis Whitaker helps James Ogilvy do a fecal disimpaction on an old woman. Noel suggests Orlando Diaz's family on cost reduction options, ultimately securing a treatment plan and package that significantly decreases expenses, thanks to Joy's suggestion to move him to surgery. Debbie's condition starts to fail, and and deteriorates into necrotizing fasciitis, putting her life at risk. McKay and Javadi provide the necessary treatment to Roxy Hamler, a woman diagnosed with advanced cancer. Louis suddenly flatlines, prompting Doctors Robby and Langdon to try resuscitation as they wait for an intubation tray. Dana Evans offers mentorship for Emma with brash comedy and seasoned precision, teaching her everything from end-of-life care to as simple as location gauze. Emma is starstruck with the presentation, with fear, as Dana manages the chaotic ED, fields diversion calls, and shuts down a grabby patient. Beneath everything is a deep trauma from her past, an assault, but turned this incident into a lesson that in nursing, even the intangibles matter as much as the facts. Around her, the nurses prove they can run the ER. Meanwhile, Donnie impresses with expertly administered suturing on a motorcycle daredevil, while Bike Talk offers Dr. Robby an escale, though fleeting. Charting stresses erupt when Dr. Santos gets scolded and reprimanded over AI-assisted notes. This tension over the use of AI fuels another argument and clash between Doctors Robby and Al-Hashimi over admitting a chained prisoner. Dana quietly ensures he must stay, a showcase of compassion with pragmatism. Tragedy strikes like lightning when Louis Cloverfield dies, despite desperate and continuous resuscitation. The trauma bay falls silent as Robby calls it official. Elsewhere, Dana guides Emma across post-mortem care, preserving Louis' dignity. In the debrief, love, loss, and love for alcohol hang heavy. Emma, holding his hand, knows that nursing is skill, resilience, and reverence working together. That's it. That's where the latest episode of the Pitt Season 2 ends. As of the time of the production of this recap, there are more coming your way, especially since the Pitt has just recently been renewed for a third season. Season 3. So what did you think of the show? Action in a hospital? Did you also gasp at the shocking scenes? Drop your thoughts in the comments below because this series really left us in awe. If you haven't already, make sure you're subscribed and hit the notification icon to stay updated on our next videos. Thank you so much for watching. See you in the next one.